Having a balanced blood pressure is surely awesome. It will ensure a healthy long life for sure. So how can you have it? Here comes the most important things to have a stabilized blood pressure. First of all, eat a balanced diet. A diet consisting of whole grains, fruits, vegetables and dairy products can lower blood pressure by up to 14 mm mercury, especially if it contains minimal saturated fats and cholesterol. Dietary changes are often the first step to lowering blood pressure. The effects may be slow if you do nothing but a balanced diet, but if you focus on eating foods that are known to lower blood pressure and add activity and lifestyle changes to your diet changes, your blood pressure will drop much faster. Once you have lowered your blood pressure, you can pamper yourself with a wafer or cookie once in a while, but you should avoid such a diet most of the time to prevent your blood pressure from rising again. Don't use salt. Sodium is the archenemy of blood pressure. A small decrease in sodium intake can often lower blood pressure by 2 to 8 mm mercury. Limit your sodium intake to 2300 mg per day or less. If you are older than 51 or have other problems that cause high blood pressure, take a maximum of 1500 mg sodium per day. You should also look at the labels of processed foods that may contain large amounts of salt. If you want to add flavor to your food, you can do this safely using many herbs or spices. Certain herbs and spices in particular can really help lower blood pressure. Cayenne pepper dilates blood vessels and improves blood flow. Turmeric generally reduces inflammation in the body, thus improving cardiovascular function and lowering blood pressure. Garlic reduces both cholesterol and blood pressure. Reduce alcohol consumption or don't drink alcohol at all. In fact, small amounts of alcohol can reduce blood pressure. On the other hand, the positive effects of alcohol may be lost after 2 drinks. When taken in larger quantities, it may increase blood pressure. Men and women over the age of 65 can drink a glass of wine or another drink with a similar alcohol content per day. Adults under the age of 65 can drink up to 2 glasses of alcohol a day. For you to follow, a glass is equivalent to 355 milliliters of beer, 148 milliliters of wine or 45 milliliters of 40% alcoholic beverage. Wine and other alcoholic beverages can lower blood pressure by 2 to 4 mm mercury when taken in small or moderate amounts. However, keep in mind that this is only useful if you are already drinking. If you don't drink alcohol regularly, the results are less obvious and more risky. Alcohol in excess can reduce the effect of blood pressure medication. Drink milk. Milk contains a lot of potassium and calcium, and both of these nutrients have been linked to low blood pressure. Dairy products also contain vitamin D, which may be beneficial for lowering blood pressure. Ask your doctor whether low-fat or skim milk is better than whole milk. Whole milk can lower blood pressure more than low-fat or skim milk, but this may have other risks. Whole milk contains palmitic acid. According to some research, this acid can block the internal signals responsible for relaxing blood vessels. As a result, blood vessels remain constricted and blood pressure does not decrease. Drink hibiscus tea. Herbal teas containing hibiscus can lower your blood pressure quickly and significantly if you drink 3 cups a day. Let the tea sit for 6 minutes before drinking it cold or hot. If you do not take measures other than drinking hibiscus tea 3 times a day, you can lower your systolic blood pressure by 7 units within 6 weeks. Hibiscus tea contains anthocyanin and other antioxidants that strengthen blood vessels, prevent them from narrowing, and blood pressure from rising. If you are using a medicine like simvastatin to lower your cholesterol, talk to your doctor before drinking hibiscus tea. Drink a glass of cranberry juice. A glass of low-calorie cranberry juice can lower blood pressure as effectively as a glass of red wine. Cranberry juice contains antioxidants known as proanthocyanidins. These nutrients limit the body's production of ET1. ET1 is a compound known to constrict blood vessels and remove blood pressure. Eat fruits and vegetables that lower blood pressure. Fruits and vegetables are an important part of a balanced diet in general, but some are particularly effective in lowering blood pressure. Eat kiwi. In a study conducted by the American Heart Association, scientists discovered that eating 3 kiwis a day for up to 8 weeks can dramatically lower blood pressure. Kiwi is rich in an antioxidant called lutein. Eat a slice of watermelon. Watermelon contains fiber, lycopene, vitamin A and potassium, all of which are associated with low blood pressure. It also contains an amino acid called L-arginine. Early research indicates that it can help lower blood pressure. Include plenty of potassium-rich fruits and vegetables in your diet. Scientists generally agree that potassium in the diet is a very important supplement for lowering blood pressure. Good sources of potassium include peas, bananas, potatoes, tomatoes, orange juice, Mexican beans, cantaloupe, winter melon, and raisins. Consider drinking coconut water. Coconut water is rich in potassium, electrolytes and other nutrients linked to low blood pressure. A study published in the medical journal, West Indian Medical Journal, noted that coconut water lowered systolic blood pressure in 71% of participants and diastolic blood pressure in 29%. Eat more tofu and soy products. Soy products contain nutrients called isoflavones that may be directly linked to low blood pressure. In a 2012 study, researchers found that diets rich in isoflavones were more likely to result in 5.5 units lower blood pressure than diets poor in isoflavones. Green tea and peanuts also contain a healthy amount of isoflavones. Pamper yourself with some dark chocolate. Chocolate is generally rich in flavonols. These nutrients reduce blood pressure by promoting the expansion of blood vessels. While all types of chocolate can benefit, dark chocolate and pure cocoa are more concentrated than milk chocolate, and they may be the best option. Studies suggest that eating chocolate can lower the blood pressure of people with high blood pressure, but the results are less obvious in people with normal or near normal blood pressure. Season the labor with hot pepper. Capsaicin, the hot component of hot peppers, can promote blood pressure reduction. Set aside 30 minutes for moderate exercise. Getting at least 30 minutes of exercise on most days of the week can quickly and significantly lower blood pressure. You can exercise both with sports activities and daily activities. You should consult your doctor before increasing the amount of daily exercise. Too much physical activity can put you at greater risk, such as a heart attack or stroke. The simplest exercise you can add to your routine is brisk walking. Walking briskly for 30 minutes can lower your blood pressure by roughly 8 mm mercury. Other types of activities you can try include volleyball, football, basketball, cycling, dance, aqua aerobics, swimming and skipping rope. Among everyday tasks that can be useful are washing cars, washing windows and floors, gardening, raking leaves, plowing snow and going up and down stairs. Take a deep breath. Slow, meditative breathing relaxes the body, causing it to produce more nitric oxide and less stress hormones. Nitric oxide lowers blood pressure by opening blood vessels. Stress hormones raise renin, a kidney enzyme linked to high blood pressure. Focus on deep breathing for at least 5 minutes in the morning, taking stomach breathing each time. Consider learning formal meditation, practicing yoga, or doing qigong or tai chi so that it affects blood pressure much more significantly. Reduce the hours you spend working. Working more than 40 hours a week increases the risk of your blood pressure getting higher. If you need to lower your blood pressure quickly, you should reduce your working hours a bit whenever possible. This is especially important if your job is very busy or stressful. Stress hormones cause blood vessels to constrict, making it difficult for the blood pumped by your heart to pass through the vessels. Listen to music. Listening to music for 30 minutes a day can help lower blood pressure, especially when combined with deep breathing techniques and hypertension medications. Choose relaxing music like classical, Celtic or Indian music. After only 1 week, systolic values may decrease. Stop smoking. Nicotine is one of the culprits of high blood pressure. If you smoke or have people around you, eliminating this from your life is a way to quickly lower your blood pressure. Within an hour after smoking, your blood pressure rises by 10 mm mercury or more. If you smoke constantly, your blood pressure will always be high. The same is true for people who are constantly smoking around. Reminder: please consult your doctor at any time before applying any treatment or doing anything mentioned here. You may have some other health issues which may interrupt or cause more serious illnesses if not professionally treated. These information, which are given here, is for considerably healthy adults and considering they do not have any other health issues which may be harmed due to these things. However, hypertension, high blood pressure, usually comes with other health problems like diabetes, heart failure, renal, kidney failure, or so more. If your blood pressure is constantly high for more than some hours and not seems to go down, you might possibly having a heart attack or might have in the short future. So please always consult a doctor for further treatment. Do not hesitate to immediately go to emergency if you are feeling terrible or terribly have head or heart pain, which are symptoms of dangerous blood pressure levels. Do not forget, a doctor will treat you better than any YouTube video. YouTube is for learning and applying if surely no danger is awaits. Stay healthy, stay balanced, stay with full of joy. And lastly, please like and subscribe so you can keep learning more life-saving information.